time to hear more about DESMOND. My name is Juliet. I'm a diabetes specialist nurse. I'm a DESMOND educator, and I deliver both the generic DESMOND and the DESMOND injectable. This afternoon, I'm with my colleague, Matt. Matt, do you want to introduce yourself?
Yeah, hi everyone. So I'm Matt and I work for Knots Healthcare, and I'm a diabetes educator all over the county.
Yeah. Yes, I do work for Nottingham City, actually. Yeah. So, but we work in partnership as Nottinghamshire altogether. Lovely. So we'll start.
Yeah, I'll just share this.
So this afternoon, we're going to talk mainly about DESMOND service and what we offer as Nottinghamshire team. If you have a question that is a burning question, please feel free, just ask the question, but otherwise we'll cover the questions at the end. So as we've introduced ourselves, that those are what we are and what we do. So please feel free. If there's anything that you want to ask us, we are here to support. Next, please. So we should all be familiar with what DESMOND is. And this is because it is part of what we offer our participants, people living with type 2 diabetes. And even as we know, the guidelines tell us to actually reinforce structured education program. I know sometimes it's difficult to have the participants attend, but basically on their first visit or recurrent appointments with yourselves, it's important to remind them structured education is available for them and it is free for them to attend because they get a lot out of it. And as we see there, it is obviously as per NICE guidelines, it is recommended alongside even before starting them on any orals, we do recommend them at least to attend some sort of structured education program. It's an alternative or equal standard should be provided for those who also who are not able to attend. And with this, we mean we normally offer other things like seeing the dietitian in place of structured education program. What do we get from the DESMOND course? We can see there the learning outcomes. We get a lot of reduction in HbA1c, promotes behavior changes. Different things do actually have as a positive outcome, supports weight reduction, and this comes in general because of the changes that the participants make from attending the session. It reduces depression. One thing we do know with managing type 2 diabetes, it's not an easy condition to manage because of other aspects of their health. But what they get from DESMOND, they get tips on how to manage their diabetes, which eventually reduces the depression risk. It also improves other biomedical outcomes. What do we mean by that? It reduces cholesterol levels, it reduces the blood pressure, and with that, it actually gives them better health outcomes because they improve in everything in general. The DESMOND education course is administered once every year, but we don't actually stop participants attending if they want to attend a second session. Say, for example, if they've attended this year and they want to attend next year, we normally give 12 months so that they give other participants an opportunity as well. And it varies whether if they attend in city or they attend in county, and we'll see that in a short while, how the referral process are and how often the sessions are run. It's also an effective smoking cessation. It also empowers the participants to know the risk with smoking, and all those changes take place because of attending the structured education program. They get the awareness, they get to know how other aspects of their health are affected by what they do. So it is quite a comprehensive course, and they learn so much about everything, which we will cover in a short while. Next, please. Some of the things that we have seen, the feedback that we normally get, I know in city alongside county, we never get any negative feedback, which is nice to know. But obviously participants benefit so much from it, regardless of the fact that it could be 2 sessions or it could be 1 day, 1 long day session. They get a lot from it, and you can see what they have commented there, quite informative. valuable sessions. Some of them have actually had their questions answered. There's a lot of myths going out there in the community and even in the media. But when they come to Desmond, they have their questions answered, which is actually the point of them attending the structured education program. Next, please. So what is DESMOND? It's an acronym, and basically it stands for Diabetes, Education, and Self-Management for Ongoing and Newly Diagnosed. So with this, self-management is the key factor. The reason they attend the education program is to empower them to manage their diabetes independently. They don't see the healthcare professional every month or every 2 months. They manage their diabetes by themselves. So that is why it's very important for them to attend the structured education program. When we deliver the Desmond, we cover lots of things. We cover what diabetes is. We talk about food. We talk about complications. We talk about their health profile, and that is why we recommend them to have a blood test so that we go through that with them. And we also support them to set goals for themselves. The reason we do that is for them to work towards something, to work toward making changes, to enable them to make those behavior changes. As we all know, it's not easy to make behavior changes. The starting point is easy, but it's maintaining those habits, new habits, and maintaining those changes that are positive, that give us positive outcomes. So what do we do? It is delivered by two educators, a healthcare professional and a lay educators, or sometimes you can have both healthcare professionals, and they are all Desmond trained and accredited. So it is an accredited course, and it is actually run nationwide. So in the event a participant, say, for example, from county moves to city, they should get the same kind of education program. That does not change. And that is why we work alongside each other. Or even if they move cities, they will be able to access Desmond, and it is the same program across the board. We normally have a small group. It's about 10 participants per group, average between 8 to 10, because then we give them an opportunity to ask what they want to ask. We share what they want to share, and we give them that opportunity to be able to open up, quite an interactive session. And when they ask to come with somebody, we do actually allow them to bring a carer with them, or they also bring a relative, or if they want their partner to come with them, we also allow that. It's quite an interactive session, as I say, and obviously we respect each other's beliefs, we respect each other's ideas, but what we bring on the table is what are facts, and this is because it is clinically researched and there is evidence behind it. We also recommend them to have a blood test and health profiles provided, because we actually cover this at the end of the Desmond session, where we actually help them set goals. So when they have their health profiles done and completed, it helps us be able to actually identify a SMART goal alongside what they already have with them. Next, please. So the Desmond course, what it covers, I'll hand over to Matt, and Matt will continue from here.
Yeah, thanks for that, Juliet. So what we're going to talk about next is a little bit about what the course covers in the different sections. Then we'll speak a little bit about the referral criteria, and we'll finally move on to some of the frequently asked questions. So as you can see here, the session is split into two sections. We start off by your diabetes story, and what that does is we call it the participant story sometimes, and that just gives the participants an opportunity to just answer some of the questions and explain kind of a little bit of an icebreaker as to their story so far, I suppose. So thinking about how they were diagnosed, any signs and symptoms, thinking about what the possible long-term effects are, and any sort of causes of type 2. In this section, we also give them an opportunity to ask any questions that they might have brought to the session. So we'll write them down at the start and then make sure that we've answered them before the end of the session. We then go into type 2 diabetes and glucose. So we speak about what happens within the body before a type 2 diabetes diagnosis. And then we speak about what the difference is once that diagnosis has been made. And just try to clear up that picture a little bit. We then move on to monitoring. So we'll explain what HbA1c is and what that means, and then speak a little bit about sort of finger prick blood samples and urine samples as well, and just give them that information. We'll have a section on food and glucose control and speak about carbohydrates and a little bit on weight management there as well. Then you can see there on session 2, we speak about the possible long-term effects. And we link that back to what they've mentioned in the diabetes story as well. We've got a section on physical activity. We speak about the government recommendations and the barriers around being more active. And we do a little bit of planning around how to overcome that and the sort of solutions around being more active as well. We then move on to the final food section where we speak about fats, and then what we do is speak about foods in terms of eating less often and eating them more often. A little bit of a practical activity there, sort of moving certain foods up and down a table and getting them really involved. And then, as Juliet mentioned, what we do is we
Matt, I think you've gone to mute.
Yeah.
Sorry, my microphone kept going on to mute there. I'm not sure why. Hopefully you can all hear me now. It doesn't say that it is. So in terms of the referral on how the sessions are run then, as Juliet mentioned, they are fairly similar in terms of the Notts Healthcare and the City Care sessions. So they're split into 2 sections. I would say a lot of the time, but it's not always a lot of the time. 2 half days, but sometimes it is 1 full day as well, from 9:30 till 4:30. When the group sessions are split into 2 sections, they are on consecutive weeks, so same time, same place, on 2 consecutive weeks. We also deliver them virtually, and that could be 2 half days, or in Notts Healthcare, what we can do is 3 2-hour sessions, just to break it up that little bit more. And then we both offer My DESMOND, which is the online version, so the e-learning. And it's the same course, but everything online. The difference, again, is City Care and Juliet and her team do deliver it in Urdu as well. So there is that difference, and delivering DESMOND injectables, which is specifically for patients who are taking insulin. So that is only delivered by City Care. Now, in terms of the referral criteria, same thing really, in that they are sort of fairly similar, just a few little differences. Anyone who's over 18 and has a diagnosis of type 2 diabetes can attend the DESMOND course. In Notts Healthcare, it doesn't matter too much in terms of how the diabetes is treated. So if they are taking insulin, or if it's treated with any other medication or diet, they will all attend the same session. However, as I just mentioned, in City Care, the DESMOND injectables is available for people who are taking insulin. Patients can self-refer, or they can be referred by a healthcare professional. And again, as Juliet mentioned, anyone can attend a refresher. So yeah, we do say at least a year on that. We do say that professionals working with patients with type 2 diabetes are more than welcome to observe. So it can be helpful. Again, people do say after they've observed the session, just to say what the DESMOND course is, what information is given, and just if anyone is interested in that, then they can get in touch with us, either team, after the session today. In terms of the results required, as you can see there, with Notts Healthcare, we do require the HbA1c, cholesterol, and blood pressure within the last year. And with City Care, which is this slide here, you can see that it's within the last 6 weeks. So just slight differences. And the other thing to mention is in terms of the referral. So yeah, with CityCare, it's either System 1 or EMIS Web e-referral, whereas with Knots Healthcare, it's System 1 or we do have paper referral as well. Now, in terms of patients getting more information, we've put this on here just, again, to refer back to at any point. There's more information online on both of our websites if patients did want to read a little bit more about the DESMOND session, or if anyone here today wanted a bit more information. So you can go on either of our websites or email us if you wanted any further information. But we thought it would be quite helpful to go through some of the frequently asked questions. So patients do often come to the DESMOND session with quite a few questions, and there are some that are a recurring theme as such. So they've been told information by friends, family, or read something online. So there's quite a few myths out there, and we just thought it'd be helpful to just go through a few. So the first one is about fruit. Fruit tends to get a bit of a bad name when it comes to type 2 diabetes. So the first one is, should I cut out fruit such as grapes and bananas? In terms of this, what we do say is that there's no fruits that are off limits after a diagnosis of type 2 diabetes. We speak mainly about the sort of portion sizes. So we really try to speak about sort of 80-gram portion sizes or 1 cup handful, and thinking about how often they're having this as well. So spreading out the portions throughout the day, not having them all at once due to the impact on blood glucose levels. We do also speak about fruit juice, and that 150 ml being one of their 5 a day. We do highlight the fact that if you think about these smoothie bottles that come in 500 milliliters, so think about the ones that you get with a Tesco meal deal or something, they are a larger portion than is recommended. So we just really do encourage that, looking at the portion sizes. What diet is best? So again, lots of information out there about this. In DESMOND, we don't recommend a specific diet. We know that there's lots of diets that do encourage health benefits, but what we do is we try to provide them with the tools that means that they can change their own diet. We've put a few examples here. So we do use the acronym of FAT, frequency, amount, and type. And with this, what we do is we do just speak about changes to their diet. So can they reduce the frequency they are having something? Can they look at the portion size? Or can they change the type? So can they change the type of carbohydrate from sugary to starchy, or can they change the type of fat? And then we look at the sustainable 100 calorie changes. Again, with this, it's not about a specific diet, it's about them making smaller changes that in the long term will lead to positive results. Can it be reversed? Again, this is a very common question. So what we do explain to patients is around remission. We know that remission is a HbA1c below 48 for 3 months or more without taking diabetes medication. And we do advise them that once they are diagnosed, they will always have type 2 diabetes and they will need to attend those yearly checkups. At this point, when we do mention remission, we do signpost to the Path to Remission program. So I know there's a session on that tomorrow. So if anyone wanted more information on that, they can attend that. But there is more information on Diabetes UK as well that I've linked into this slide. So I'll pass you back to Juliet for the final frequently asked questions.
Yes, thank you, Matt. Is there mild diabetes? I've been told that I'm borderline diabetic. We get this a lot, whether it's in clinic or in DESMOND. Most of the patients come and say, I was told I'm borderline and I've been referred to attend DESMOND. And we do tell them there is nothing as borderline diabetes. You're either pre-diabetes or you have overt diabetes. And that is a diagnosis of above 48 millimoles or above. That is, you have actually type 2 diabetes. And most of the time, we always discuss about mild diabetes. Majority of the patients or participants who have type 2 diabetes think because it's, or they feel because it's type 2 diabetes, it is mild diabetes. There is nothing such as mild diabetes. Diabetes is diabetes, whether it's type 1 or type 2 diabetes, because both types of diabetes or even type 3 diabetes, they will end up causing some complications if it is not managed as it should be managed. Some patients also attend believing that they do not have type 2 diabetes. And that, I think, is a misconception when they're advised that they have borderline. They don't understand what borderline means. So it is ideal. We normally explain to them what pre-diabetes levels are and what actually diabetes levels are. So that confusion is out there. But I think it's important for the patients to be aware that what pre-diabetes is between 42 to 47, and over diabetes is anything above 48. Next, please. Can metformin damage kidneys? Yes, that is a huge question that comes into the picture. Most patients are started on metformin as per guidelines, which is a very good drug actually. And we normally start it alongside lifestyle. And you also take metformin even without having diabetes for some conditions. So we encourage the patients, by no means that we tell them metformin causes damage to their kidneys. What they have seen is just what they have had out there, the myths that come with it. And mainly we encourage them to, we raise awareness that metformin is a very good drug that helps with insulin resistance. So it is important to keep taking the medication. The main concern that the participants have or the patients have is the side effects. And we explain to them why patients possibly get the side effects. It's because of whatever time they take the medication, and we encourage them to make sure that they take their medication with food or after food. And we reassure them as well that before they even start the metformin, they always have their UNEs taken, and that is their kidneys are checked beforehand, and nobody is actually given or prescribed for metformin if their bodies cannot cope with it. So that is the reassuring bit that we actually give them to know that their kidneys are normally checked before they start the metformin. And I think it's important to encourage them to know that they need to take their medication with and after food, otherwise they get gastric side effects, because we have patients who, some of them take the medication and they haven't eaten or they don't have breakfast, or some of them take it at bedtime and they had their evening meal probably at 4 o'clock or 5 o'clock. So it's reminding the participants that they must make sure that they take the metformin with food. Next, please. Can type 2 become type 1 diabetes? That comes up a lot as well, because patients get a little bit confused when they go on insulin or they go on a GLP-1 because it's injectable therapy. But we tell the patients what the differences of the diabetes, the types of diabetes we've got. There is the main two types of diabetes is type 1 and type 2 diabetes. And when they go on, if they have type 2 diabetes and they go on insulin, it's not that they have gone to having type 1 diabetes. Their pancreas is still producing some insulin. It's just that they needed a little bit more. So we give them a surplus whereby they start injecting the insulin. Type 1 diabetes difference is the pancreas is not producing any insulin at all because it's an autoimmune condition. That is why the patients live on insulin. But type 2, regardless of age, regardless of how long you've had the diabetes, the pancreas will continue to give you a little bit of insulin, but we are supplementing what you already have and what you continue to produce. Next, please. So on there, what care to expect? We've added that slide because it's important to remember what the key care processes are for these patients. And it's because type 2 diabetes definitely can be quite a debilitating condition. So it's important. I know it is difficult times. I know we don't have time. Everybody is busy. But the question is, what do we give these patients? What checks do they have done yearly? There are some checks that we run every year, depending on the patient in front of you. But sometimes there are patients who have their checks more often. Say, for example, if it is retinopathy screening, some of them are seen 6 monthly. It is now changed to every 2 years if they're stable, but it depends with the patient in front of you. The most important thing is to make sure that the patients get all these checks done, because we do know long-term diabetes causes a lot of complications in the long term. So unless they have these checks done, it's difficult for us and for them to know what to do with their diabetes. So the Diabetes UK website have a very good link. We've attached the link there. And there is a new booklet they've actually published most recently. And you can actually request it. You can order it free. It is free, and you can give your patients to take with them, just to raise awareness of what checks they need to have across the year. And also it helps our healthcare professionals to actually, if you're not sure, it helps you to know what actually these patients living with type 2 diabetes need to have alongside their yearly profile. Thank you. We are free to answer any questions that you might have. I don't know whether there are any questions in the chat. Adam can have a look at it for us.
Yeah, thanks, Juliet and Matt. There's only one at the moment. So it's come from Shelley. I think going back to that group sessions of when they are delivered, do you offer evening, weekend slots?
That's a good question. In city, we used to offer weekend slots, but the turnover was really, really poor. We did try, we were running it in town, which was convenient for anybody across Nottingham City, but we stopped because obviously it was not cost effective. So unfortunately, we don't offer weekend sessions, and we don't offer evening sessions either. And I think it's the same with county. I don't know.
In Notts Healthcare, we don't deliver evening sessions, but every now and then we do weekend sessions, either virtually or face to face. But yeah, they're spread out throughout the year. It's not sort of a regular weekly thing, again, due to patients actually booking on and attending.
Oh, the reason why I asked that question is because obviously we're diagnosing people much younger now. And one of the key things that I tend to get is they can't get the time off work, or so to try and sell it, if I know that they probably do like a couple of sessions a year where they're weekends, it's quite useful to just sow the seed, if that makes sense. That's one of the main things that I found, that with the people that are retired, then that's great. And I know there is online, but not everybody wants to do online, which I completely get. But thank you anyway. Thanks.
But going back to that, Shelley, that's a very good comment, because there is a lot that is going on behind scene, because we have lots of patients now who are getting type 2 diabetes when they're really young, and we're looking at an appropriate education program for them. So we will keep you informed on that. Yeah.
Thank you. I think that's really important, because some of the some of the feedback I've had is from the odd person that has been a bit younger. They felt quite, how's the word without sounding aging well or ageist?
I know what you mean.
Yeah, they said that they felt quite isolated, because a lot of the people are a lot older than them, and their stories were very different. So at the beginning of the session you were talking about their stories. So that's some of the feedback that I got. So that's interesting. That's good. Thank you.
Yeah, no worries. We'll keep you informed.
Yep, thanks for that, Shelley. There's no other questions from any of the participants, but just want to maybe touch on that, the digital offer, the My DESMOND. In terms of people accessing that, do they refer the same way as they normally would do, or is that different from the face-to-face sessions?
So with us, it's the same sort of referral process. And then when we do get in touch with them, then they can let us know that they want to do My DESMOND instead of attend a face-to-face or virtual session. So.
It's the same with City, but that doesn't mean if they attend face-to-face or virtually, they won't get my DESMOND. They still get my DESMOND to access it in the next 24 months. So it is a surplus, even if you attend face-to-face. And we do encourage them to attend face-to-face because then they can have the group session dynamics and learning from each other, unlike just doing it online.
Yeah, thank you very much for that. Like I said, there's no other questions, so maybe give it another.
Sorry, Adam. I think Rebecca's hand was up at some point.
Sorry, it was just.
Sorry,
I was just going to
Rebecca.
add. No, it's fine. I took it down again. I was just going to add Shelley. Shelley, I think, are you West Bridgeford? Is that right?
Yeah, I'm West Bridgeford. Yeah.
So we do about 3 Saturdays a year in West Bridgeford, 3 or 4. And then we do more virtuals, so maybe about 3 virtuals as well. So there should be the opportunity for them to come. And then, like Adam just says, they could do my DESMOND as well if they can't get the time off work.
No, that's great because it's just another selling point.
Yeah, I just thought
You know,
so. It is probably about 3.
Yeah, and to refer them, and I hope that if they're referred, then they sort of like, you know, they're getting in the process a bit. So that's great. Thank you, Rebecca. Thanks.
That's all right.
Thanks for that. Yeah, there's no other questions, so maybe give it another 20 seconds. If anyone does want to ask a question, you know, please type it in now or speak to Matt and Juliet and Rebecca as well.
It's me again.
Yeah, go on. Sorry, Shelley. Go on, Shelley.
One last question. Juliet, you said about retinopathy. Has that gone to 2 yearly? I'm a bit slow here then. If they're stable.
Yeah, they've made changes. If they're stable, it's now every 2 years. That came to effect from last year.
And that's nationwide, I presume, then, including
yes.
Yeah.
Okay. Yeah. But obviously, if they have problems, they're seen sooner.
Okay, thank you.
Yeah, it's okay.
Thanks, Shelley. So yeah, there's no other questions, so maybe we will leave it there. If you do think of any questions that you may want to ask Juliet or Matt at a later time, please email me and I'll pass it on to the relevant person from whatever area you are. Okay to share the slides later, Juliet and Matt, with the participants and those that couldn't attend today?
Yep, that's fine.
That's okay.
Yeah, great stuff. Okay, well, thank you very much, everyone, for attending. Thank you, Juliet, Matt, and Rebecca, also for putting that presentation together. And we'll see you all again soon.
Thank you.
Right. Thanks for listening, everyone.